To start to say is I originally thought I was going to be facilitating an Oscar Peterson, where I'd have two pianists up here, and I'd be the little drum in the background, and ye'd be the bass group down there. But I think we might go instead and try and do a more looser thing, where we might ask questions, but please, people, participate. Throw out questions, throw out opinions, whether they agree or disagree, and we'll have a conversation, would be great, and we'll follow along as much as we can. I'll just start the process, I suppose. The one thing that struck me was how harmonious your two presentations were, because I was thinking about, to let go power and role leaves you uncertain, indeed managing the uncertainty, and then part of uncertainty is letting go power and role, and I just wanted to see what she felt of those two. I thought there was a real harmony and mixed colours there. Yeah.
I believe that's where the real power is. Right? I was so struck this morning when Dr. Alice Kirby talked about how our schooling nourishes this binary thinking frame of mind that really appeals to a sense of control that's a fantasy, right? And real leadership, if it's happening in the most intimate moments of the clinic or in more broader scale things, is about, part of it is about really listening to what people have to say and to finding the meeting point, right? And that's the real power. The real power is not in controlling everything. It's in being able to give over that power and listen and join your learners or your patients or your team or whoever it is to together find the way forward and see the entire picture. So that's how I see it from a visual perspective.
Yeah. Right, and same thing from a jazz perspective. My wife, who's in the audience, is going to start rolling her eyes now, but all the wisdom you need in this world is in the movie Kung Fu Panda 1. And there's a scene in the movie where Shifu, the greatest Kung Fu teacher in all of China, is having trouble teaching the big clumsy panda Kung Fu, and his master, Master Oogway, the originator of Kung Fu, says, Shifu, Shifu, the panda will never reach his destiny, nor you yours, until you give up the illusion of control.
That's fantastic.
I'm telling you, all the wisdom you need is in Kung Fu Panda.
Will someone talk to the Tory party over in the UK, please? So if anybody has any questions, please put up your hands. Sorry, my mic is falling. This is how you manage uncertainty. So if anyone has questions, please put their hands up, and when the mic comes. Just before, I'll just ask Ethan just a question. I was interested because you were talking about interprofessional working, but I thought that theme of jazz interacting and letting go control could easily be the doctor-patient talking and having to respond to letting go control of your traditional doctor role as well as working with other colleagues. Yeah.
Absolutely. I mean, the jazz musicians, I've been blessed enough to be able to intersect with a number of jazz musicians, and the jazz musicians all talk about the process as having a conversation. And they talk about when it's going really well, they talk about this sense of flow, where you're in the moment and you're making decisions, and the decisions are good ones, and your training has prepared you for this moment, and you're seeing all the data, and you're slowing down appropriately and speeding up appropriately, and you're in this state of flow where it's moving well.
Okay, brilliant. Any questions there from the audience? Just over there, yes?
Paul, question. Could you give us an example or a couple of examples of how you use these sorts of music listening techniques to teach other lessons, and what are those lessons?
Absolutely. We actually teach a course at Penn State called Jazz in the Art of Medicine, and I think the thing that I so resonate in Alexa's talk with is the idea of art as the entree into thinking deeply about what we do and preparing for what we do. So we do a whole exercise about developing your voice as a doctor, and who are you, and trying to integrate the best of your strengths into your medical work. And we use the jazz by listening to Sarah Vaughan and Billie Holiday as an entree into developing your voice, just like the visual thinking strategies are an entree into seeing, right?
Any other getting that, I'll just ask Alexa a quick one. I work with students, and what I find them really struggle with uncertainty, and particularly in an era where they have to know so much knowledge, they have to follow guidelines. If you make a mistake, you will be called out and publicly humiliated, and the lawyers are hanging out the door, waiting for those mistakes to occur. So, how do you work? I think it's more difficult for people to manage uncertainty nowadays than when I was young, interestingly, because of all those pressures.
Yeah, I mean, the pressures are so real. And I think part of it has a big and important piece of it is the way in which teachers teach and the systems through which they've already been successful and sort of expect to get rewarded and also expect to get shamed and humiliated, and that those systems are structured and in many ways are not reflecting reality.
Yeah.
And of course the pressures are real. And of course, they shouldn't just hang out in uncertainty. They do want to move things forward and make decisions and find the right answer. So I think there's an extent to which you validate the fear and welcome that that's real, but that, and also help them see that there's a huge difference between the clinical realities and like performing on a test. Yeah. And at the same time, I think a lot of it has to do with just in the way in which a really skillful doctor will create a climate where people feel safe and you can get all of the information that you need. Teachers need to do the same with their learners.
Learn through.
More of a comment than a question that will probably end up being a question. And this is just sort of like a plug for Alexa. And being someone who has seen her do her work and has worked with museum educators over several years, I think there's so much that clinicians can actually take away from watching museum educators and artists do their work. And I think one of the most important things that I've gotten out of sort of seeing you do your work and some of my colleagues is be able to stand in front of a painting or a work of art, an art object, with clinicians and ask questions, open-ended questions, and just being able to be comfortable with silence. To be able to not have to fill that space and to see what happens. And I think that a lot of people who are coming from your side feel like they have to sort of adapt to how their work applies to clinicians, but I also think equally that a lot of clinicians actually can borrow practices of that you do on a regular basis as part of your job, and it's so critical to what we do in taking care of patients.
Well, thank you so much, Jay, and you've done extraordinary work in this space. And I also want to say, just on the flip side, yes, that's true. Being comfortable with silence and actually knowing you have to rely on having silences to have nonverbal information processing and for things to continue. And I actually just saw an article last spring. The author's last name is Moulton, about the skill of taking a pause at the right time and recognizing the right time to take that pause and make the silence as an advanced clinical skill. So they just continue to go right back and forth.
Okay. Any other further questions? While we're waiting for that question, I'll ask yourself, Paul, in terms of you wanting teams to work like this, and at the moment that relies on having someone inspirational like you who's willing to let go control. Is there ways we can introduce structures into medicine that means it isn't reliant on these fantastic individuals who are willing to do it? Or how do you think in terms of the whole structure, which is very hierarchical and structured?
Yes, I think we can challenge the structures and culture each strategy for breakfast. I think that the culture will morph around any structure we create. I mean, the story about the buttons in the hallway is one such example. I mean, I think that I've come to believe, I started out my career trying to change the world, and where I've come to in my career is I try to change myself. It's the Gandhi quote. If you want to change the world, find a way to transform yourself. And if it's a good transformation, the world will start transforming around you. And I think that's incredibly difficult You know, I practiced as a clinician for 10 years before I asked the nurse on rounds, what do you think? And it wasn't until I was specifically attending to, I need to find a new way of being here, that I could start changing things. So I think it's a call to all of our students, all of our teachers, all of our physicians to attend to your own transformation, and that takes conscious effort and focus.
Okay. More reason for coming on conferences like this too. A question down. I have very poor eyesight, so someone has to tell me is there a question.
Hi,
There.
Alexa. Your talk really resonated with me. I'm an emergency doc, and I'm here with lots of my colleagues and my primary care colleagues as well, and we're always under time pressure to see patients and to make diagnoses and to come to the right diagnosis. And I think some of my questions have been answered by Jay's comments as well, but in a time-pressured situation, what are your top tips to physicians to maximize that space of uncertainty that you talk about?
Oh, that's such a good question. Can you raise your hand? I don't see where you are.
It's right in the back.
Oh, hi. So I should prepare a list of my top 10 tips for high-pressure situations. I think it really has to do with you have to make the best decision possible at any given moment, and also recognizing, I think being really discerning in recognizing what is fully known and what might not be fully known, and doing the very best you can, but always having that be clear. You know, staying present and open to what information might come up. Yeah. I should have a better answer to your question. I'm sure there's actually probably incredible thoughts on that to harvest from this room, so maybe we can keep talking about that.
Yeah.
I've been hearing about structure and structured training, but in actual fact, the last two speakers, I think very appropriately, actually were deconstructing training, because they were looking at means of observation that has been lost. And in terms of the jazz music, seeing that piece of music played in two different ways and then being able to interpret that. And similarly, looking at a piece of art and seeing something that isn't initially there but becomes part of your awareness after further inspection. And I think in terms of our training, it's too structured. It's far too structured. It doesn't allow for that deconstructive nature of what you're both talking about. And I think that the issue sometimes of apprenticeship in medicine, again, has been lost. I think apprenticeship led to this observational part of training, but again, that's been lost. Any comments on that?
It's like the idea of curriculum is a tick list and leaves no space for that freedom to explore these other issues.
Blue skies are blue, green fields are green.
Yeah.
There's so many colors in the rainbow. I mean, we've lost the colors because we've been taught to observe in a particular way. So we've been, so the structure has actually become so rigid that we can't see the deconstruction that both of you have been speaking about this afternoon.
One comment just which comes to that, because the thing is, I've worked on teams, and I like loose structures, but that can be a problem. And I find that I tend to work better with people who like structure, which can be really difficult because,
I think it really has to do with what the structure is, because there are structure. You can have unstructured environments that go nowhere and are really wishy-washy, and you sort of reflect on nothing for a long time, and it's pointless.
Yeah.
Or you can have structured processes that feel very unstructured, but are actually highly structured and derived from cognitive science-based principles for how you facilitate learning in an open-ended way, or how you, how you coach somebody through a learning process that often feel very unstructured and allow for a lot of deconstruction, but are highly structured, and there's research on that. So, and I think that medicine could do much better there's actually quite a lot of research out there on methods that stem from the cognitive sciences that really work to facilitate learning in a very active way. And medicine could certainly do better to look to those structures, and I mean, I have observed so many dumb reflections. You know, I'm all for reflection in practice. That's a huge part of what my work stands for, but you have to know how to bring a reflection somewhere. And I see a lot of bad practice being perpetuated in those spaces too. So I take your comment very seriously, and I also think it's about what the structure is and always knowing what the objective is and how to get there.
I totally agree. I think that, you know, one of the problems with the renewed interest in using the arts in medical education is I talk to some educators, and it's as if the art is the end, and to me the art is the entree into insight and growth. And so both Alexa and I pulled you into a realm that may have been more or less foreign, depending on your background. But in this foreign realm, we did a little exploration, but then both of us had you start constructing in your mind, how does this, if at all, relate to my medical practice? And that's the kind of focused reflection they want. That's where the insight is. I think somebody was working on some spectacularly new stuff for medical education, and I'm the director of medical education research, so they came to me and said, how should we measure this? And they wanted to measure patient-centeredness and empathy and all these standard sort of things. And I said, you know, if I were going to measure something in your medical school, what I would measure is how many of your medical students gave up their hobbies while they were in medical school, and how many of them that keep their hobbies can explain how their hobby relates to their medical practice. Because if it's working, I would expect that less of your students are going to give up your hobbies, and more of your students are going to be able to see the connections between that which they do outside medicine and that which they're doing inside medicine.
Absolutely. Any questions down there?
So what are your hobbies?
Oh, there.
Hello.
Yeah.
Thank you both for those excellent talks. I'd like to sort of compliment the sound system, actually, because that jazz sounded absolutely fantastic.
Yes.
So, Alexa, I think I may be aware of your work. Did you work with Holly Gooding in Harvard by any chance?
No.
Fine. We'll talk about that later. I mean,
there are a lot of amazing people at Harvard doing incredibly creative things.
Yeah. Well, I work for Exeter Medical School, and for very many years we've had a medical humanities program in our medical training, which comes in year 4. And I think my question to you was, both of those talks were about observation of art and how that sort of helps, you know, good illustrations of how that helps people sort of develop observational skills or team working skills. But I think the approach that we use is that we'd like people to actually embed in the creation of art and in so doing sort of see life from a different perspective. So I just, and in so doing develop their tolerance to ambiguity, or their, the term you use, which was their approach to uncertainty. So I just wondered if your experience is that as well? Or
Yes, absolutely. And I just want to say, like, there's so much good medical humanities work, and there's so much good stuff to be learned, like, across art forms. And so that's great to hear that you're doing that. And, you know, Paul and I, we each have sort of shared one small slice that's quite focused. So in my case, art observation and confidence on the edge of the unknown. But of course, it's much bigger than that, and it's all quite interconnected. But I think, you know, and observation drawing is incredible. And that's, I was a drawer as a kid, and I did a lot of intensive drawing training early on in my life, and that has been fundamental to sort of just how I see the world and my work. And certainly in the Harvard class, we were giving them drawing prompts every week and doing life drawing, and we were going to the museum and doing art observation, but we were also having them draw patients, and then watching patients breathe, and sort of reinforcing these things across forms. And so that work is so good, and there's so much to explore in it. And in my experience, the richness of the interdisciplinarity is incredible, and that's also the challenge, because you have to have like a very clear, focused objective if you are going to like sort of show a way that the students were different after the intervention. So I would encourage you to like go with that and really mine sort of what it's really all about and the particular connection that you're making.
Can I ask you a question? My partner's an artist, and one of the things she has a bugbear about is when she meets my medical colleagues, they all come up to her and say, "You're so talented." And she says, they don't realize I had to do an awful lot of hard work to become this. And we've talked about her art and my work. And she says there's times that the drawing or the painting is flowing, and there's times it's just not coming out, and she has to just stick at it.
Yeah.
And that happens to me in surgery. There's times it's just tough going, and you just, whatever you say, it's the wrong thing, or you ask the wrong question. And then there's days you go in and you're just flowing. And it's that sense of flow. And I don't know, but her point is you have to work hard to get to that point of flow. And I don't know if you find that with art and music, yeah.
I once partnered with Michael Piccioni, who is the internal medicine program director at Bay State Medical Center in Massachusetts, and he's also a thumping good blues guitarist. And Michael and I were having a conversation before I was visiting, doing one of these jazz things, and we were talking about jazz and blues and what have you, and we started talking about Charlie Parker. And the musicians have a term called woodshedding. And the story of woodshedding is that Charlie Parker was like 17 years old. He was the hottest thing around Kansas City, and Count Basie was in town, and he asked to sit in with the Count Basie Orchestra. And he gets up to play, and Count Basie, so Count Basie says, "Sure, play." So he gets up to take his solo, and he plays this blast of notes. Parker was later quoted as saying he could hear bebop before he could actually play it. So he plays this undisciplined notes, and the band's completely disgusted. So one by one, every member of the band stops playing, till Parker's on the stage playing his saxophone alone, doesn't even realize. And the drummer, who's this guy named Joe Jones, this mercurial guy, Papa Jones, takes his cymbal off of his drum kit and frisbees it at Parker. And it lands right next to him on the stage. It crashes, it ends the solo. Parker walks off the stage with his tail between his legs. And he swears he's never going to play the saxophone again. And that lasts for about 2 days. And then he gets all the Count Basie records he can find. He goes out into a woodshed, his grandmother's backyard. He spends the entire summer in the woodshed practicing. And when he emerges from the woodshed at the end of the summer, now he's Charlie Parker, the greatest saxophonist in jazz history. He goes back to the club where Basie's playing, asked to sit in again, and now he gets up on the stand and he's Charlie Parker, and people's jaws are dropping. They're hearing him play things on the saxophone that they didn't even think possible on a saxophone. And Michael and I were talking about this, and what emerged from this was a paper that we called "The Clinic is My Woodshed." That Anders Ericsson would talk about deliberate practice, but you don't get better if you're not consciously focused on the practice. And as doctors, where's our woodshed? It's the clinic. But you're not going to get better at communicating with patients if you're not consciously working on something as you're seeing patients. And so we constantly work on our craft to improve our craft. And if you stop mindfully working on your craft, that's when you plateau.
Absolutely, yeah. Couldn't say it better. Anyone else with a question there?
Hello, hi. I'm Andre Rochford. I'm a family doctor, and I'm involved with the Irish College of General Practitioners Doctors' Health Programme. And I'd like to thank the organisers for bringing art and music into our afternoon and for widening the discussion from observation and reflection into human interactions. And Austin, you mentioned your partner is an artist, and my daughter is an artist. She had considered medicine, but she now has a degree in fine art. And I've really enjoyed the journey with her during her undergraduate and now her postgraduate life. And when I'm talking to groups of doctors and medical students, I talk about work-life balance, and hobbies and creativity, but I always ask a question and open it to the audience. And those audience may be groups of GPs, hospital doctors, grand rounds, international meetings, as I'm involved with some doctors' health groups internationally. But I just want to share something with you. When I've asked first-year medical students about their hobbies, there's often a long period of silence. So then I ask them, what did they do? What were their hobbies? And then they open up. So I think we need to have discussions and reflective pieces in our medical education from year 1 onwards. Thank you.
Thank you.
Agreed.
Just to comment on that, Andre, Ming Rawat, who works with me, you probably know well, she once told a student that she was going to fail her until she saw her leisure program. And the student said it was one of the best things that was ever said to her. I think it's time to wrap up, and I don't know if you ever heard what the word inspire means, but the actual word inspire means to breathe life into. And I felt that in a sense, this session this afternoon will breathe life into the way I'll work with patients and the way we may all work with patients. And I just say thank you very much, both of you, for that. And thanks very much.
Thank you. Thank you. Thank you.